thank you for joining us today. My name is Leah Hailu, and I'm an intern with the Equity, Inclusion, and Diversity Committee here at Mayo Clinic's Department of Laboratory Medicine and Pathology. For today's video, I'm here with Jake, and he'll be answering a few questions about his role and experience at Mayo. So Jake, if you'd like to introduce yourself a little bit.
Hi, Leah. So as you said, my name is Jake Steele. I'm an associate project manager with Mayo Clinic Biopharma Diagnostics. We're a subgroup of DLMP and Mayo Collaborative Services. My group specifically focuses on research projects that want to use Mayo Clinic's vast wealth of testing for their clinical trials or academic research projects.
Okay, thank you. And can you tell me a bit about some of your favorite things to do in your role?
Yeah, so as an associate project manager in Mayo Clinic Biopharma Diagnostics, I get to use my pharmaceutical and clinical lab background to work with a diverse group of stakeholders both inside and outside of Mayo Clinic, which I find to be really exciting to be that liaison between external clients and then the people within Mayo Clinic.
Mm-hmm. And can you tell me more about why you chose to work at Mayo Clinic?
Yep. So my wife and I originally came to Mayo because she matched here for her medical residency in 2018. Having worked for other companies and then now having experienced Mayo Clinic, staying here long term was an easy decision because of just how tangible Mayo's value-driven culture is.
Mm-hmm. And bouncing off of that question, I'm going to jump ahead on my list. And can you tell me a little bit more about how Mayo compares to other places you've worked at?
Yeah, so the culture here at Mayo is unlike any other environment that I've experienced. I think the Mayo Clinic values are just so meaningful, and everyone here on Mayo, everyone on staff here at Mayo kind of contributes and buys into the culture that our values build.
Mm-hmm. And can you also tell me how you feel your role makes a difference for Mayo patients?
So my work falls within the research field here at Mayo Clinic. And it's important to remember that patient care is constantly evolving, and the work that my group does helps us meet these changing needs of our patients. Specifically, we support clinical trials and other smaller academic research initiatives that will help improve how our patients are cared for in the future.
That is super important. Thank you for that. And can you also tell me about what do you see in your future at Mayo Clinic?
Yep. So my group, Mayo Clinic Biopharma Diagnostics, we have a startup feel to us because we're a relatively small and rapidly growing group. I plan on pursuing some more advanced project management roles within our department, and just because I really like the work and I really like being in that research environment.
Last question, can you share a story or a moment where Mayo Clinic helped provide you with a sense of belonging?
Yeah, so there's so many different opportunities to be engaged here at Mayo beyond just the day-to-day responsibilities of each position. One
Mm-hmm.
specific example that I have is that recently our work group volunteered to make dinner for guests at a local homeless shelter here in Rochester, Minnesota. And so for me, being a part of a team that can not only focus on our work tasks, but also come together to support the community outside of work or after our work hours was just a wonderful experience that really helped myself feel a part of the team.
That's fantastic. And do you have any other comments that you would like to share with our audience today?
Yeah, so one of my favorite things to do is to walk around the subway between the Mayo and Gonda buildings here in Rochester. I think just watching the interactions between patients, volunteers, and staff and listening to the piano playing is just a really humbling experience that emphasizes the Mayo mission and our values.
Mm-hmm. Well, thank you for speaking with me and for doing this project.
Thank you.